Preparing for joint replacement surgery is a team approach. It starts with the patient first and foremost, myself as a surgeon, physician extenders such as physician assistants and nurse practitioners, my scheduler, and oftentimes we send vitamins to tee up the body to allow you to heal optimally. We often schedule your follow-up appointments before the surgery, including your physical therapy appointments and any necessary medicines. And then we plug you into what's called the joint class. And it's offered by each of the hospitals that I operate in. And it's an invaluable opportunity to learn about your experience in the hospital and what to expect afterward. And a lot of times, all the questions and concerns that the patients may have is addressed during that class. And after surgery, we never let our patients feel like they're alone. After surgery, I visit them in the hospital. Myself and my physician extenders make ourselves available, whether it's through a phone call, an email, or even virtual programs like Health Loop that we often employ, so that patients can interact with us either through a digital platform like email or this app, or even call us on the phone. And it's a constant interaction, and our relationship often doesn't end, maybe for years.